Hi, my name is Tara, and I'm a nurse at Connect Medical Clinic, and we are a clinic for sexual health and for pregnancy. And this month is Pregnancy and Infant Loss Month, and so we are here with Deb Howie. Deb is from CHI St. Alexius, and tell us about what you do over at CHI.
Thank you, Tara, and just wanted to thank you for all you do too. So I am the chaplain at CHI, have been there for 33 years. And we believe at CHI that all life is sacred and should be treated with respect. So it's our policy to bury all those babies that are 20 weeks under in gestation. And then the families also have a chance to bury them themselves if they like. And of course, any babies over 20 weeks gestation must go to the funeral home. But any 20 weeks and under, we keep them for 1 year and then we bury them. And then we invite anybody, well, all the families back who have designated that they want to come back or want to be notified of the burial. And we have that once a year in September. We just had it this last Thursday. It's a beautiful day. Some days we have, or some years we've had to do it in the snow. So we enjoyed the fall day. So it was very nice. The people that came were very thankful. They can invite whoever they want to come, of course, their parents or friends or whatever, to support them. But they also then get to see the other people that have lost someone too and realize it's not just them. And then they find out where their babies are buried. We bury them all in one plot together for the year. So they have a place to come back to too and bring flowers or whatever. So it's a very nice thing. It's a very solemn event, very short, just the graveside. We have a Catholic priest and a Lutheran pastor, and Trinity kids volunteer to sing for us. So it's just kind of short and sweet. We do not invite the public at large out of their privacy, for the privacy of the families, because maybe some of them didn't want anybody to know they're pregnant, you know. So we just keep it to the families that wanted to come back.
That sounds really, really special and really meaningful, and a beautiful service and a tribute to those lives that were lost. Just a couple sentences. What advice do you have for those who would be encountering someone who's lost a pregnancy or lost an infant? What should we say? What should we do when we want to bring comfort and to show we care?
You know, Tara, it would make a difference how well you know this person. I mean, if we're talking the people that you and I would run into through our services, I think sometimes just saying, I'm so sorry, pre-COVID, a hug might be a good thing. If tears come, let them see the tears from us as well. But as you and I have talked, there's so many things that are the wrong thing to say. And I've heard most of them being said because people feel like they have to do something. So really saying nothing is really better than saying the wrong thing. But of course, if you know the person, it's your neighbor, relative, whatever, offering to pray for them if you know that's something that they would feel good about. Just remembering that child. Sometimes that child the baby is maybe only 10, 12 weeks, and maybe nobody else knows that it's gone, and so they don't get the sympathy. But if you can remember that child, when you see them the next time or something, they want to talk about it, there may come a time when if you had a similar experience, we never say, I know how you feel, because we don't. But you might slip in, well, when I lost my daughter at, some 10 weeks, whatever. And then if they want to ask you about it, you can talk about it and share. But otherwise, we don't take over the conversation. We let them, it's their their time. We let them talk, and so.
Yeah. All
Yeah.
very, very wise words, Deb. Well, thank you for all that you do for these families and for the community. We really appreciate you and CHI for thinking of this and remembering those lives and those families who've lost them.